So, Dr. Miocinovic, DBS has been personally really important in my life. It really was kind of life-changing. So I'm curious, having you doing research in DBS, can you just tell me a little bit about what is your research and how that fits into to DBS?
Sure, yeah. So I study primarily how brain cells communicate with each other, specifically how that communication goes awry in movement disorders such as dystonia. So we are learning that brain areas that are responsible for movement have increased synchronization, meaning that normally we would think that different brain areas should work independently, but sometimes when they're working too closely together, they're too much in sync, and that can be a bad thing. So for example, for somebody who has generalized dystonia, when they want to move their right arm, their left arm may move as well, even though they don't want it to. So it's this increased synchronization that is becoming sort of a biomarker for dystonia and some other movement disorders as well. And so in a recent study, we learned that DBS actually reduces this abnormal synchronization and allows brain to function more independently. So we are hoping to use this information to develop a new generation of smart DBS devices. So the idea is that the device would monitor this amount of synchronization by itself and then be able to self-adjust and turn up the stimulation to provide maximal benefit, but then at other times when brain may be functioning more normally, that it can sort of ease off so that the patient doesn't get side effects from too much stimulation.
Got it. And so this is the adaptive DBS that I was reading kind of a little bit about.
Exactly, yeah. So that's sort of the hot new topic in the world of DBS is it's called closed loop or adaptive DBS. It's these smart devices that can self-adjust based on the person's own symptoms at the time.
Got it. So, and I know, DBS is one part of this larger field, this neuromodulation field, and I'm kind of curious, can you talk a little bit about what other research is going on in neuromodulation?
Yeah, so I mean, there's still so much that we don't know about dystonia, and specifically why two people who may have very similar symptoms respond to therapy differently, such as DBS. So one of the things that I find most frustrating when I'm in clinic with patients with dystonia, I cannot tell them for sure whether or not the surgery will work. So it's sort of a gamble, and I think that's very difficult for people to accept, and I totally understand it. So what I really want to understand better is how we can tailor therapy for individual person, and that may be through measuring these brainwave patterns, or maybe doing genetic testing, or maybe doing high-resolution functional MRIs, or a combination of these. So, and I think also another great development would be to come up with a non-invasive way to alter these brainwave patterns so that people don't have to have invasive surgery, particularly if that surgery ultimately will not work. So if we can predict ahead of time who may or may not respond to DBS, that would be a really great accomplishment. And then the other thing that I think would be really exciting is also, can we find a way to permanently alter these brainwave patterns so that people are not dependent on the device for the rest of their lives? So I think there's a lot of exciting opportunities for us.
Yeah,
in the future.
That's really interesting. So I'm also curious, what made you interested in dystonia as a research field?
So dystonia is one of these really fascinating conditions because it can be so unusual and it can present in so many ways. And most doctors don't know what dystonia is. Even if they had heard the term in medical school, they probably won't be able to recognize it when they see it. So I was the same way. I finished my neurology residency, which is actually 4 years of training after medical school to become a general neurologist, and I barely knew what dystonia was. So I chose to do another year of specialized training in movement disorders, and then I did another 2 years of research training thanks to the DMRF clinical fellowship program. So I was able to spend 2 years at UC San Francisco to study patients with dystonia. And really then that allowed me to come to Emory and start my own research lab and continue to treat patients and seek new therapies.
Thanks for sharing that with me. As I mentioned, DBS definitely was life changing for me. I think there are very few things you can call life changing. So I really appreciate your time kind of talking a little bit about it because I think it's a really important topic.
Thank you very much.